Alright, so this is one of the countries that I wanted to look at first. This is the United Kingdom. Their last census was 2011, contained a population of approximately 68 million people. Some further demographics on that. 6.1% of their population is below the age of 5, 20.8% of their population under the age of 18, and 21% of their population is over the age of 65. And this 21% of the population will let you know exactly how old they are because they are not afraid to use it as a weapon in negotiations. Vaccines. Note on their vaccines in the UK, their current 2 vaccines are only approved for the use of people or use in people above the age of 16. What that works out to be is approximately 18% of their people are not eligible. The census statistics come from the Office of National Statistics. The National Health Service is who gave me all of the numbers about the denominators here. 88% of their population has had at least 1 dose of the vaccine 4 weeks ago. At least 4 weeks ago. 78% of their vaccine or their population has had 2 doses more than 4 weeks ago of the vaccine as well. And what this really works out to look like is we have an eligible population of 55.76 million people. 43.5 million of those are vaccinated currently, which looks kind of like this. I've taken a couple of liberties with these numbers and rounded up to the nearest 10%. We have the not vaccinated and part vaccinated crowd taking up only 2 out of every 10 people in the country. 8 out of 10 are covered. And this gets us pretty darn close to herd immunity. It's not perfect by CDC standards yet, as we'll learn later, but this is pretty close to what herd immunity is supposed to look like. Not eligible currently are anybody under the age of 16. That's 12.24 million people, or 18% of the 68 million population. None of them are subsequently vaccinated. What that means is in the blended population, you have essentially 64%, rounded to 65, just to make my stick figures look nice. So we have approximately 65% of the population currently fully vaccinated. But the interesting caveat to this country of the UK is there is approximately 15% of the population that is partially vaccinated. This is going to come into play a little bit in the way we see our numbers coming out of Great Britain, but it's an important distinction nonetheless. And then we are still left with 2 out of every 10 individuals not having any kind of vaccination whatsoever. One of the other interesting polls I saw coming out of Great Britain is that they only have 4% of their population indicated any kind of vaccine hesitancy, which is pretty impressive. Great Britain, for all of its failings society-wise, being an island nation and being ungodly expensive, they do trust their NHS, their National Health System, almost to a fault. And it's fantastic to see. It's really an interesting exercise in what a consistent message should look like. And one of the things I've noticed in Great Britain when it comes to public health messaging is no matter what political party you're coming from, the message seems to be pretty consistent coming out of the government, which means more people are likely to follow the advice of the government. If both sides of the aisle essentially are saying the same thing, then we don't see the same level of vaccine hesitancy as we do in the United States. And that's going to come into play with a couple of numbers that we're going to see later on in this video. I just wanted to preface this by putting in Great Britain first. And then we're also going to get into an explanation in a little bit as to how viruses, how we model our viruses as well. So stay tuned. This is going to be an interesting episode of Drug School. Welcome aboard.
Drug School is a project of CompassionRx. Help keep this content free and publicly available with your tax-deductible donation today. Click in the link in the description below for more information. Study materials to accompany drug school episodes can be found at bookshop.org. Support local independent bookstores and this channel by selecting your PTCB test prep books by using the link in the description below.
Alright, so one of the things I wanted to get into before we got too deep into the weeds in this video is understanding how bad a disease can possibly get. We do have a way of modeling diseases. The value you'll hear is called R0, or sometimes the reproduction value. And this has some very, very important information for us as public health professionals go. And what we're trying to do is gauge how virulent a disease is. How bad can we get if we let a disease run rampant? Now, COVID-19 really isn't bad in terms of how many people it can infect with one case. And we'll get into a couple of examples. Granted, they are outdated in nature. It does have a couple of limitations to it. One, it assumes the entire population's at risk. So when we first had COVID-19 coming out onto the grand health space, everyone was at risk. No one was vaccinated against it. It was a new disease. So really, the firestorm is set where we could potentially have everyone get sick. Which brings us to the second piece of this. No one has antibodies to it. And at the time that COVID-19 first joined the world space, no one did, because it was brand new and our bodies are very specific on viruses. And then there was no way to control the spread. And this is why you saw a lot of public health measures at the beginning built to flatten the curve. So just as a few examples, COVID-19, when it first came out into the public health space, we believe the R0 value, or the replication value or reproduction value, was closer to 2. Through further recalculations, and depending on who you ask, that number has swelled to 5.7. Some have referred to it as a range between 5 and 9. And according to a couple of pieces of literature I've read, that means herd immunity is only achieved when 82% of the people have antibodies to the disease, either through immunization or through natural obtaining of the disease. This is good and bad news, and we'll explain why natural herd immunity isn't the way to go here. A couple of outdated reference values just to kind of give you an idea of where we're coming from. Measles, which is outdated, mainly based on some models from 1912 to 1928 here in the United States. R0 for measles is approximately 12 to 18. Again, we don't use it because we have vaccines for MMR. And this really isn't as relevant now. That being said, it does have some meaning to us because there is a growing anti-vax contingent in many societies, and then there's also some places where vaccine delivery just hasn't caught up to where it needs to be. And in those particular cases, we are seeing R0s more along the lines of like 5 or 6, but not as bad as they used to be, and that's because our entire population is not at risk. Pertussis, again, an outdated one. There's a vaccine for it. So there's a very relevant reason why we don't have it. There could be an R0 for influenza. I couldn't find one in the short period of time I had to research this video. But pertussis, again, outdated. And this is based on models 1907 to 1917 in the United States. And then there was also some further study on it. 1944 to 1979, that was the UK and Wales. They came up with an R0 of somewhere between 12 and 17. The US model said something along the lines of 12.2. The UK models came up closer to that 17 marker. And again, it just shows some of the subjectivity and observational pieces here. What goes into calculating all of this is variable depending on which organization is calculating it. And you could get some variability in this because we have to look at things like how the disease is transmitted, how many days it incubates, how many variants are out in the known marketplace. So do you keep recycling susceptibility, for example? We don't have all of those details when a virus first emerges. So we have to keep reinventing the wheel on this one. When COVID first hit the world stage back last January, and I say last January, we didn't see our first case in the United States until middle of March in Michigan, but in the United States as a whole, we had our first case back in the tail end of January, early February. And I suspect that we actually had a lot more going on between February and now. It's just we weren't testing for it, so nobody knows if it was real or not. What we believed at the time was for one infected person, every two people would be infected. And it kind of followed a pattern for a very brief period of time. For example, when I had COVID back in December, I got it from one other person. Now, we were able to control the spread of my particular COVID case because I isolated for 14 days. And during those 14 days, I infected only one other person. That would be the other household member here in my house. The ultimate goal of a vaccination campaign, by the way, in calculating this R0, is getting a vaccine out in the marketplace that will reduce R0 until it's a value of less than 1. R0 values of 1 means that for every one case you're going to get, you get one other case. So the R0 of my particular COVID case was 1 because I infected one other person. Now, the person I got COVID from, their R0 case would actually be 2 because they infected me, who I in fact turned infected someone else. And I'll show you what that looks like in a picture model here in a moment. An R0 of less than 1 means the disease is actually on the decline. There is no community spread. Anything greater than 1 indicates community spread. And that means for every case you generate, you can potentially generate more than one case. So we're going to model this here. I'm going to erase this up real quick and then I'll show you what it looks like. And again, sorry for the creaky chair. Okay, so let's take a disease. We'll call it the DS disease. So let's say we have disease DS. We know it's an aerosolized disease. We know people are going to catch it through the air. Time of infection is pretty short and whatnot. So we believe R0 to be approximately 3. So what is going to happen when we get our index case? So let's say we get index case 1. Here is our index patient. This index patient is going to go on to infect 3 other people. I am not an artist, I am a pharmacy technician. There are pharmacy technicians that are also artists, but I'm not one of them. Now, each of these 3 cases is then going to go on to infect 3 other cases, because our entire population is going to catch DS. I'm trying to go viral here, can you tell? Okay, so now they're going to infect 3 others. And so we'll call them patients 1, 2, and 3 here and whatnot, because I can't draw that fast. Now, each of these patients is then going to go on to infect 3 others. And this is how we create our disease models. Okay, so now where we had 1 index patient, now we have 3 subsequent cases. Here we have 9. We are now going to have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, and 27. Now, if you've ever seen the movie Wayne's World, this is the point in the movie where Wayne goes and so on and so on and so on, and you just see the screen multiply and multiply and multiply into multiple Waynes. Well, guess what? That's going to happen here. So now we're going to have each of these 27 cases is now going to replicate 3 times, which means we are now going to have 27 times 3 cases, which is 1, 2, 70, 81. Sorry, that's 81. So now these 27 cases are going to go on to infect 3 other people. Now we're going to have 81 cases. And this is just going to keep cycling and continuing and continuing and continuing until we either burn through the entire population or we reach herd immunity. And once we reach herd immunity, this number dies off pretty quick because no one else is susceptible, or very small populations are susceptible to gaining additional patients. Now, diseases are tricky. So what happens is, in a virus, and there's a long-standing debate about whether a virus is alive or not. So a virus is just a protein shell. That's all it is. It's a protein shell. It usually has something on the outside that allows it to bind to something in its host. In the case of coronavirus, and the reason we call it a coronavirus is it looks like a crown. It has these lovely little spikes all around the outside. There are prettier pictures than what I'm drawing here. Feel free to find some clip art if you'd like. Okay, inside this spike are one of 2 things, either a full strand of DNA or a partial strand of RNA. Fully stranded DNA viruses are a lot more stable than RNA viruses are. And the reason DNA viruses are stable is because they have to error check everything that they do in terms of replicating. Single-strand mRNA viruses are not capable of erroring their copies, or checking their copies for errors. This is why, so an mRNA virus, when it mutates, think about what it looks like when you copy something and then you copy the copy of the original instead of the original. So the lines get a little blurrier and they start looking a lot less like the original as you go on. But let's say you take a copy and then you fax it and then you copy the fax. That's what an mRNA virus is a lot like. And then you fax it again, or you fax the copy, which in then turn you copy that second fax. What ends up happening is you're going to get something that looks like the original, but it's not an exact copy of the original because it's all distorted now. That's what an mRNA virus would look like. And we're starting to see that now, and it wasn't terribly uncommon to see genetic variants. Now, genetic variants can take one of 2 different forms. They can be minor alterations to the genetic code of an mRNA virus. Think of it as having children. It's going to look a lot like its original, but it may not be a perfect copy. Because what will happen is as this infects a host, it plants itself into a host, and then it copies onto the DNA of a host cell. The problem is it can't make a perfect copy. So instead of being all black in this particular instance, the copy is going to have a little segment of blue added in. And this blue is a genetic variant. It still looks a lot like its original host, except now it has this blue piece involved. It's not going to change ultimately how this virus replicates or how it's involved or how it sits. In the end, it's still the same virus. Now, if a virus starts to genetically change, so either it changes the way its spike proteins appear or it changes the genetic code on the inside significantly, that either makes it stronger or weaker. Those are called genetic shifts. And those genetic shifts mean that while this virus had a blue piece originally, now it's all blue. Still looks like its original host, but now it's all blue instead of being black and blue, or just black. And this would be a genetic shift off of the original, because now the immune system may not recognize this new blue piece. And this is basically the concern about you hearing about the Delta variant today, is we don't know if the vaccines are good enough to conquer the Delta variant. So far the data says yes. But if it shifts again, and supposedly there's talk of there being potentially a Lambda variant out there now. They're going right down the Greek alphabet for those not playing the home game. So let's say there's another genetic shift in this, and now it becomes a red virus. I don't have my red marker out right now, so I can't do that. And educators all over the world will tell me that red is a bad color to use because no one can see it. So let's say Lambda comes out, and the spike protein now actually has a genetic variation to it. Well, the spike protein we just trained all of our immune systems to go look for is no longer the same spike protein as the current Lambda variant. I'm not saying that that's what the case is now. I'm just saying that's one of the potential things that can happen. And then what will end up happening is the vaccine will end up not functioning against a new variant, and then we're stuck revaccinating everybody using a new genetic sequence. And that means we have to go back to the drawing board, we have to do annual boosters and whatnot, and then it starts acting like a flu shot rather than a more permanent fix in coronavirus land. So those are our main concerns with the way the data models appear today. Alright, so now that we've taken a look at the UK, let's take a peek at a state that has some moderate success in getting vaccinated. The UK has done a real good job at developing more of the herd immunity that we're looking for. That number was approximately 70%. They're pretty much almost ready to bowl over 80, which is fantastic. And the even better news is they were able to do it in about 3 months. We're 7 months into our vaccination at the time of recording here. And this is September 1st, by the way. So let's take a look at the state of Michigan. This is the state that I live in. This is the state I practice in. I'm really familiar with these numbers. I've been looking at them every day. And Michigan is a really great state to do some epidemiological work in because our denominator is roughly 10 million, give or take a couple 100,000. So, and people who are clinicians who are probably watching this channel are sitting there going, give or take a couple 100,000, like, aren't you missing something in that data? Generally not. And when we talk about public health and when we talk about the overall social situation, we take smaller sample sizes of those populations all of the time. And if you want to take a look at that, go look at a drug study. So it's not terribly uncommon that we're looking at smaller populations in general. Just okay, not the greatest, but it's okay. So Michigan, as of the 2020 census, is 10 million people. The state of Michigan is using a 2019 number on their vaccine website, which is about 130,000 people shy of this number. So realistically, are our numbers going to be that much different? No. In the state of Michigan, 5.7% of our population is under the age of 5. 21.5% are under the age of 18. So school-age population is about 1/5 of this number, which is about 2 million people. And that number is going to show up right here. And then we do have 8.6 million people. This is according to the coronavirus vaccine website for the state of Michigan. And all of my sources for my information are going to be below in the description of this video. And you're more than welcome to validate my numbers and contradict me. I am not an epidemiologist by any stretch of the imagination. I just know how to read these numbers and convey them because I'm a health educator. I have to be able to do those. As far as the vaccine goes, 60.5% of our eligible population has completed the vaccine. That's pretty good. That means we've vaccinated 5.16 million people out of our 8.6 million people who are eligible for the vaccine. That's great. There's still a lot of work to do. Because if you're following these two numbers, there's 3.5 million people that aren't accounted for yet. And it's even more when you add in some additional statistics over here. Well, let's finish talking about this table I created over here. So of our population, 60.5% of our eligible population has completed their vaccines. When we talk about school-age children, so those that are 12 to 19 years of age, and you're all sitting there going, high school ends at age 18? No, it doesn't. I was almost 19 when I graduated. So December babies generally fall in the higher end of that age category in the second category. So those aged 12 to 19, about 3 or 4 out of every 10 have been vaccinated. And that's an important statistic when we talk about mask mandates in schools. When we talk about the 20 to 29 age, about half this age group would be in college right about now. The other half are either just joining the workforce or they will be shortly if they haven't already. 4 out of every 10 are in that group are vaccinated. 30 to 49, that number is about 5 out of every 10. And you'll notice that these numbers are getting slowly higher as we go along. And that's just because order of eligibility kind of like falls in line. Especially when you look at these bottom numbers here, the ages of 50 to 75 plus, those are chronic conditions. Those were also the population that were eligible for the vaccine first. So we're seeing 65 to 80% of that age group set already vaccinated. These vaccines in the age 30 to 49 group are approximately 6 months old. They would have been done late March, April, into May. The age 12 to 15 group was vaccinated July-ish time frame. And then the age 16 to 19, 20 to 29 would have been also eligible in that late June or late April, early May category time frame of being eligible to get the vaccine. So we really are working at some of the age groups that are just recently eligible for the vaccine, so those numbers are naturally lower. We're going to probably see some uptick in these statistics. There kind of is a little bit of a nudge upwards in the graph that shows completed vaccine status and initial vaccine status on the State of Michigan website. So that's promising. Now that the vaccine is FDA approved, hopefully we can get some more people on board with this vaccine. Although, as they keep releasing more and more information about the vaccine, I'm noticing an increase in the creep-in of vaccine hesitancy. So, where people are going, okay, you didn't know you were going to need a third dose? And I was like, I probably saw the freight train coming that said that we were going to need a third dose, in the fact that if we look at the hepatitis B vaccine, particularly Twinrix, where it's a Hep A-B combination, there is a 3-dose series for that, and it's like every 0 weeks, 4 weeks, and then like 3 more months down the line you need the third dose. So I'm not surprised to see that. So of our eligible population, 5.16 million of that eligible population are vaccinated. Works out to be about 6 out of every 10. That's this number right here. Children 18 years and younger represent 2 million of the population of the state of Michigan. About 800,000 of those are vaccinated. It actually worked out to be pretty close to 40%. So I was really glad to see that it was that close. But that does mean there's 1.2 million people who are eligible for, some of this population is still eligible, I should say, for the vaccine that hasn't been vaccinated yet. We really need to get them on board. What does this look like when you blend it all together? Because not all of this 2 million population is eligible for the vaccine yet. That's a problem. We still have 3.5 million people who are eligible for the vaccine, haven't gotten it yet. There is a little bit of overlap here, not great. So what we're going to do is we're just going to combine this 800,000, this 5 million vaccinated. Works out to be a little bit around 5.62 million. This came off the state of Michigan's vaccine website. This number might fluctuate a little bit because the vaccines were available to more of the population in Ohio and Indiana, and as well as Wisconsin, sooner than they were in Michigan. So we had a lot of people jump the border. And when you border as many states as Michigan does, it's going to tend to be a problem. So approximately 55% of our total 10 million population is actually vaccinated to date. This is as of September 1st, 2021. What that looks like, 5 out of 10 are, 5.5 out of 10 are vaccinated, 4.5 out of 10 are not. Why do we care about this? Well, our overarching goal in a vaccine campaign like this is to prevent our healthcare system from being overrun. different from the goals of a lot of other populations where they're just trying to not keep the virus around. They're trying to actually eradicate it. It's going to be a little bit harder to do when we get into some of the myths and truths about coronavirus as we understand them today. We're going to see some of this shift. And with some countries, you saw them trying to eradicate the virus. That's just so they can open up. When we looked at the UK, that was one of their goals of a vaccination campaign, was to try to eliminate this virus as much as they could. They're an isolated island nation. If they can't get off the island, then they can't get goods, they can't get supplies, they can't get construction materials, they can't get all of the basic things they need to do to survive. A lot of that stuff in Britain is imported. They cannot make it on site. Case in point, their vaccine is actually made in Europe, mainland Europe. It's not made in Great Britain. So they have to make nice with their neighbors, and they have to try to control some of that community spread so that they can really start getting back to some level of normalcy so that they can actually have regular supply chains again. And until they get there, it ain't going to happen. In the United States, our general overarching goal is to eliminate community spread so that we do not overrun our healthcare system. Now, in the state of Michigan, we're doing a much better job of that than other states like Mississippi. And we're going to talk about Mississippi here in a minute, because when we talk about having two worlds of coronavirus, the state of Michigan, 60.5% of our eligible population is vaccinated. However, the overwhelming majority of that population that is not is in the rural areas. They are harder to get to. They are not generally receptive to having the vaccine. They're politically more conservative. So when we talk about having two Michigans, it's not terribly surprising to see that. And when you look at the state of Michigan as a whole, we see the Mitten. This is the Lower Peninsula. For those of you who have never been here, we do this regularly. So it's not terribly uncommon that you see, if people are talking about the state of Michigan, we'll hold up our hand, because it's just an easy graphical tool. So we do have the Upper Peninsula too. We can't forget about that. This is the Keweenaw Peninsula. I don't bend that way. It actually bends up and around. But this is the state of Michigan. Everything above the knuckles and north is wooded, no man's land. The population is very sparse. The population centers are not very big. The largest population centers in northern and lower Michigan maybe have 25,000, 30,000 people. That would be Traverse City. Alpena is probably about that big-ish. Sault Ste. Marie is about 10,000, 15,000. Goes up to about 25,000 when school's in session with Lake Superior State University. Marquette, also equally sized population. Not so much now that the Air Force Base closed up there. So when Sawyer went away, the population of Muskegon just kind of like died out a little bit. But for want of a better term, we're not talking about major population centers up there. And when we get up into the northern and lower peninsula, everything's much more remote. It's an hour drive to anywhere. So going and getting your vaccine, probably not very easy to do unless your doctor's office is right around the corner. Good luck with that. Your pharmacy's probably several miles away. So nothing is convenient up there. And I've been up there several times in my youth to know that the drive between Mackinac and Sheboygan is easily 35 minutes. Now, there is a doctor's office in Mackinac City. I think there's also now a pharmacy there, too, as well. But when you're talking about having a 45-minute drive to anywhere, people aren't just going to, like, run out to go get a shot. They need to do that with something else. So they're probably running out and going and getting groceries, or they're going and getting some other building supplies and whatnot. So we kind of have to like really hit them where they are. So that's why our pharmacy vaccines going up north are rather important. And then there's some islands up there that are really remote. Some of them are on fire right now, thanks to climate change. So we really have our work cut out for us in northern lower Michigan. And that's probably maybe 1 million people on a good day. And I think actually when I was helping the Independent Districting Commission draw lines, I think there's about 500,000 people north of the Knuckles, as I like to call it, and that's kind of my dividing line. The Knuckles, by the way, geographically, if you want to see them on a map, it's called US 10. Pretty much everything above that is forest. Everything below that is southern Lower Michigan, which is much more urban, much more population center driven. So you would have, in southern Lower Michigan, you have Detroit, you have Grand Rapids, you have Lansing, you have Battle Creek, you have Kalamazoo. All of those are population centers that are approximately 100,000 people or greater. You have the ever-merging Muskegon-Holland area, kind of melding together. That's probably good for another about 50 or 60,000 people. So about 95% of this number live south of the Knuckles. And that's driving a lot of the 60.5% vaccination rate. And we're going to talk about Mississippi. Mississippi is even more rural than you can ever imagine. So when we talk about Mississippi, we're going to talk about a lot less dense state. And then Mississippi has had some very unique challenges of late. So we'll talk about them next, and I'll see you in a moment. Alright, so now I've reset everything for the state of Mississippi. And when I mentioned earlier that states record data a little bit differently, Mississippi definitely doesn't have as many resources as the state of Michigan does to really slice and dice the data. So I've had to resort to using a whole host of different sources than I'm used to using for evaluating a public health, because normally when I would look up vaccine information, I would go to the State Department of Health and Human Services, or the Department of Health in the case of the state of Mississippi, and really use their information that's publicly available. So I've had to go back to the CDC to get some information. I've had to go back to the Mississippi Department of Hospital Administrators, the Mississippi Association of Hospital Administrators, to get some data. So the lines are a little bit more blurred in the state of Mississippi, which might account for some of the misinformation that you typically see, because you can construe the data to meet your particular agenda. So when we look at the state of Mississippi, according to the 2020 census, they're approximately just shy of 3 million people. Again, makes it really easy to do a little bit of math, because we can just round this off to 3 million and probably be somewhat in the realm of accuracy. 6.2% of that population is under the age of 5. That's rather important when we talk about school-aged children. 23.1% are under the age of 18. 76.9% then are adults over the age of 18. As of August 30th, 2021, this video is being recorded on September 1st of 2021, 1.1 million people are fully vaccinated. Roughly works out to 1 out of 3. It almost ends up being 1 out of every, or 4 out of every 10, I should say. According to the Department of Health's website, it's 39% of the population. Not sure where they get this number, because I came up with about 37%. Of their vaccine-eligible population, 44% are vaccinated. So roughly works out to 4.5 people are vaccinated out of every 10. 5.5 people out of every 10 are not vaccinated. Children under the age of 18, this was a really hard group to come up with a number for, so I didn't. But with their lower vaccination rates, it really doesn't matter. And the reason I say it really doesn't matter is one of the things that they've been tracking is outbreaks in schools in the state of Mississippi. And since school started at the beginning of August, they are now tracking approximately 16,242 cases of COVID-19 as a result of schools being in session, and most of those schools not having mask mandates. So they've really had some outbreak work ahead of them, and a lot of these schools have multiple cases of COVID-19. Several of them are tracking, and most of this is actually coming from the students themselves. 13,715 cases of COVID-19, according to the Department of Health, are students who have contracted COVID since the beginning of school. Now, while we can say school is probably a source of the outbreak, and that's highly likely, schools are, generally speaking, not very well ventilated. They're, especially a lot of the older schools, are not very well ventilated. Mississippi's schools are not exactly of the newest high caliber standards, so yeah, we expect to see a few more cases out of their school population. But it leads me to believe that this population is largely unvaccinated. The statistics state that there's probably only about 7,000 kids between the ages of 12 and 18 who actually have received both doses of their vaccine as of August 30th, 2021. Again, that's from the Department of Health's website and their COVID vaccine tracker. That chart was not easy to read. So if anyone has any information on how to read that better, I welcome your input. Leave me a comment below. Blended population, though, 1.1 million people, roughly speaking, are vaccinated out of a population of 2.96 million. Comes out to be about a number of 37%. For argument's sake, we're going to call that 4 out of every 10. And that leaves 6 out of every 10 people unvaccinated. This is putting an extreme strain on the Mississippi healthcare system. And we'll talk about what this overall effect on being largely unvaccinated is doing to their healthcare system when we talk about hospitalizations and whatnot. I'm going to reset this board. We're going to talk hospitalizations when I come back. Alright, so now that we have gone through some of the background information, I would like to take us off to some of the statistics here. We're going to talk about the UK, Michigan, and Mississippi, just like we did before. There are a few limitations to what we're not going to talk about. We're not going to talk about how well the vaccine was working within several human beings' bodies because that muddies the waters. That's one of those confounding factors in epidemiology that we just don't like. It muddies the waters, doesn't really give us a clear sense of what really is going on in the overall population. I also want to talk about time since vaccine. In all reality, we're only about 6 to 7 months out on most people's vaccinations. So we haven't really reached that 8-month threshold that the vaccine manufacturers really want us to look at. Breakthrough infections, they're there. They're a thing. Probably more seen in Michigan's information and also probably the UK rather than Mississippi. And the reason we know that is because only 1% of Mississippi's cases are coming from vaccinated individuals. 99% of their case count is actually from the unvaccinated population. So that's a very important note to keep an eye on when we talk about Mississippi specifically. When we're talking about Michigan, we're probably seeing some breakthrough here, and definitely in the UK there's some breakthrough there. The UK did release some statistics that I saw on Medscape a few weeks ago about how well their vaccine is really working. And remember, the UK is using a different vaccine than the United States is. The United States has a choice of 3. The UK pretty much is doing this with 1 or 2 vaccines, one of them being an AstraZeneca vaccine that was developed at Oxford University, and then the other vaccine they're predominantly using is the Pfizer vaccine. Here in the United States, we had the J&J vaccine. We also had the Moderna and then the Pfizer as well. The Moderna was not used predominantly in the UK, and that was because of that whole blood clot thing a few months ago. Really kind of turned them off. They actually discontinued that use. So let's talk about some numbers. Just for comparison's sake, remember the UK is a population of approximately 60 to 70 million people. Michigan hovers around 10. Mississippi's floating around 3 million people. So just for context, when you see these higher numbers in the UK, just remember that the other 2 geographic areas really aren't as large. And when we're dealing with raw numbers, that's really difficult to actually really look at. And what we typically would do is I would probably normalize this amongst 100,000 population and then rate it that way. So you can see how well the UK is doing versus the United States and whatnot. And my epidemiology professors would probably roast me over the coals for not adjusting these numbers to standardize the populations, either by age, doing what's called an age adjustment, which means then we try to like even keel the age sets of the United Kingdom, which really oddly for the United Kingdom in the state of Michigan, if I age adjusted their numbers, they still would look a lot like this. But then we would be normalizing it amongst a 100,000 population or a 1,000 population, depending on what geographic area you're working on. One of the other things that we didn't take into effect here is geography. How much of this is rural, how much of this is urban, how much of this... we've really, in the pandemic, we've really gotten past a lot of that. In the state of Michigan, I would say safely that a lot of what's driving their case counts right now is from the rural areas. The state of Mississippi, just because of how under-vaccinated they really are, it's the entire state. And then the UK, they really didn't specify how much of their vaccine coverage is coming out of urban versus rural areas. And it really doesn't matter when you're talking about a population that is as vaccinated as they are. The other thing to note is that even though 78% of their vaccines or their population is fully vaccinated, almost 90% of their population has had at least one dose. So they're far more protected, and what you really see that is right here in this ICU number. Compared to Michigan and Mississippi. This is an entire country's ICU statistics, whereas you're only looking at individual states here in the United States. And Mississippi being a much smaller state, this ICU number actually has a 1 in it that doesn't belong there. My apologies for making that mistake, so I've got that corrected now. So otherwise, they had just almost as many hospitalizations, but it's important to note that 90% of their 903 ICU beds in the state of Mississippi are currently occupied. There's only about 90 beds available in the ICUs in the state of Mississippi. And this really has an impact on what your state is available or able to do. So when we talk about ICU beds being occupied, you're sitting there going, okay, well, the state of Michigan only has 1,246 ICU beds that are occupied. The state of Michigan only has 3,043 ICU beds available in the state, and 77% of them are currently occupied for one reason or another. And when you start creeping up amongst the 90% marker, which is what the state of Mississippi is doing, it's very important to note that that now constrains the capacity across the entire healthcare system. For those of you who are completely unaware of what's going on in the United States, Mississippi just had a hurricane affect a good portion of their state. So they're dealing with flooding, they're dealing with a lack of water supply, they're dealing with a lack of fresh water being available because it just got rained on with a whole pile full of seawater, which is going to change how your water is going to electrolyze and whatnot. And when we talk about having fresh water available, that's how hospitals replenish their oxygen supplies. So they don't have like big oxygen tanks that are just delivered to them like daily. What they do is they take the fresh water supply that's coming into the hospital, they run it through an electrolyzer, and then they store that oxygen into oxygen tanks. So as your fresh water supply becomes constrained, that does limit how much oxygen is available for your ICUs to actually deliver. Having power to run those electrolyses, having power in general is a constraint on the healthcare system. So when we're talking about all of these trauma situations, we really have some very large constraints on the healthcare system in the state of Mississippi right now. And all it would take is one major disaster to occur, like a hurricane, and their hospital system would be completely overwhelmed. Now, In the northern part of their state, they do have one saving grace in the fact that they do have a major ICU ward available to them that is not in the state of Mississippi. It's actually in Tennessee, and it is in Memphis. Still not a major help to them because you have Louisiana also borders Memphis in the northeastern part of the state of Louisiana, and that if both their healthcare systems are constrained, and Louisiana's is certainly far more constrained than Mississippi's is, because the city of New Orleans just got beat by Hurricane Ida, and that's going to cause some constraints on the healthcare system. So having 90% of your ICU beds is not a good thing by any stretch of the imagination, and all it takes is one mass casualty event, and your complete ICU capacity across the state is overrun. And you really don't have a lot of backup geographically in the state of Mississippi because the COVID situation in the southeast part of the United States, Texas, Louisiana, Alabama, and Florida, as well as Arkansas for all intents and purposes, all of those states are completely overrun with COVID cases. And there was at one point last week where there were only 20 ICU beds available in the state of Mississippi. The other 60 became available because, people didn't quite survive the COVID infection. The other interesting statistic that came out of the state of Mississippi was even though 99% of their cases are unvaccinated individuals, 87% of all hospitalizations and subsequently all 80% of deaths are the result of unvaccinated people. So 9 out of 10 people who are getting COVID and getting hospitalized for it are not vaccinated, and likewise in the same situation, deaths, there was only 13% of their deaths. I don't have deaths up here. Deaths were 36 per day in the state of Mississippi. So you're talking about, roughly speaking, 1 out of every 10 of those deaths is a vaccinated individual. 9 out of 10 of those deaths were not vaccinated. The other thing is they have had 16,242 cases in schools since school started. State of Michigan, I didn't look up school statistics yet because school just started last week, so we don't have any information yet to report. Mississippi's been in school since the beginning of August. Michigan just started back to school. For those of you who are not aware, Michigan has a state law that schools have to get a special waiver from the Department of Education in order to start schools before Labor Day. And only a small percentage of schools actually do that, and they're mostly in southern lower Michigan. Northern lower Michigan will not be back in school until after Labor Day. So we don't have any data to report on schools yet here in the state of Michigan. I'm not very familiar with the UK school situation, so I don't have any data to report on schools in the state or in the United Kingdom either. 7-day new cases. There were 3,780 in all of the UK in the last 7 days on average, new cases. But keep in mind this is on like 252,000 tests being done. So the positivity rate is only 4.2%. In Michigan, we had 1,121 new cases on average over the last week. And the positivity rate on those cases is approximately 10.5%. In the state of Mississippi, they've had 3,230 new cases on average each day for the last 7 days. Their positivity rate's hovering around 22%. They are 5 times higher for community transmission of COVID than the UK is. And keep in mind the UK is a much larger land space to cover than the state of Mississippi is. So, and the UK is a much denser population than the state of Mississippi is. So we really are looking at trying to get down to here. This would be utopia for us in the United States. We would have to multiply all of these numbers essentially by to get to the United States population, but for argument's sake. The other interesting statistic came out of this vaccination rate. In the ICUs in the entire country of the United Kingdom, 988 people are in ICUs and on ventilators. 435 are in ICUs in Mississippi, and almost all of these are on ventilators. I think it was like 378 of them are on ventilators. So there's a very large portion here, and they only have 903 ICU beds in total in the entire state of Mississippi. State of Michigan, we fare a little bit better. We have 3,043 ICU beds. 1,246 of those are currently occupied by a COVID patient. 77% of our hospitalizations in the ICU are occupying beds today. We aren't in as dire of a strait as the state of Mississippi is. And the UK, by a long shot, is nowhere near being in a dire state. They're feeling the Delta variant, especially in their 7-day new cases, and a lot of this is breakthrough. When they were talking about their vaccine effectiveness, what they were coming up with as far as their vaccine effectiveness, they were saying that their vaccines ended up being prevented about 78% of vaccinations altogether, 78% never contracted coronavirus or were asymptomatic. As we're seeing here, 23%-ish. Again, there's some rounding in here that kind of makes those numbers not jive. 23%-ish developed either mild symptoms or they developed symptoms at all. And then to compound that, they're finding about 2% of their population ends up getting hospitalized. They had 6,479 hospitalizations on average over the last 7 days. That came out to be a 2% hospitalization rate. 0.4% were serious in terms of how badly their population was getting COVID in the first place. And then their fatality rate after being mostly vaccinated went down to 0.00003%. That's a low chance of getting of dying of COVID. So the UK is faring much better than the rest of the United States is in comparison. Most of the state of Michigan is considered to be high for community transmission right now. All of the state of Mississippi is. I think there's 2 counties in the state of Michigan that are still in susceptible levels. They're primarily rural counties up in above the knuckles. One only has like 1,200 people in the entire county. So, and Michigan counties are notoriously boxy. They're supposed to be 36 square miles each. So the population density in those 2 counties is particularly low. And the reason they're considered to be susceptible is most of the people have to travel at least an hour to get groceries. So they're putting themselves in harm's way by going to an area of higher population. So here are these are the raw statistics. When we come back and redraw this board, we're going to talk about I'm going to call them truths, partial truth, and flat out lies. And we'll explain why in the data we believe each of those is occurring. So I look forward to seeing you back when we redraw this board. Alright, so now that we've redrawn this board a little bit, I want to get into some truths, some partial truths, and some lies. And depending on who you're talking to, this is all muddied waters. And you'll notice that the pure truths, there are few and far between. And that's because the truth really lies somewhere in between. And I can see where some people are stuck in the middle. And they're spewing off what they believe to be a true statement, and they're kind of right, and they're very much not. So I call them partial truths. And then there are just flat out lies. Although this very first flat out lie, it says the vaccine kills people, we really don't know that. There have been reports that link the J&J vaccine to having some issues with blood clots. They were less than 1% of the vaccine population. Likewise, I think Moderna was the other vaccine that developed a very similar soundbite. Again, that side effect profile was very, very minimal. And then there were a whole bunch of unsubstantiated there are some very unsubstantiated rumors surrounding vaccines where people got the vaccine and like 3 weeks later dropped dead. And we don't know exactly what caused those. So while people are making those assumptions, we really don't have a lot of great data on that. And a lot of it's just because we can't link the death to the vaccine or vice versa. So it's going under the misinformation category for now. Stay tuned for more details because that likely may change. Masks deprive the user of oxygen. I hear this one a lot, particularly on my side of the state. Masks do not deprive a user of oxygen. If that were the case, surgeons everywhere would be dropping dead. And I, quite frankly, would not feel comfortable going into surgery if I knew that my surgeon was deprived of oxygen. And the last one is schools cannot force my child to wear a mask. And this is outright lies because there are at least 5 Supreme Court cases I can quote. 3 relate to a case in Michigan. And none of the information supports that says public health measures cannot be taken in schools. 1905 would probably be the earliest case in public health land. Not too terribly long after we came up with germ theory of disease. And that particular Supreme Court case, Jacobson versus Massachusetts, said that states do have the right under the police authority to mandate vaccination. Well, much like that, we can force people to wear a mask. We can force public health measures. So states can use their police power to do this. The federal government has a very similar mask mandate for transportation. That comes out of the United States Department of Transportation's regulatory power. And most of that regulatory power says that if you do not mask in your public transit, you do not get funds from the United States government. And of course, transit, it being very money starved in this country, went, fine. So they did. So yes, schools can force you to wear a mask. Technically speaking, county governments, particularly in Michigan, could potentially say, yes, you must get a vaccine. That would be like suicide to do that, because I think we would spark a civil war. But it is possible to do. And the Supreme Court not only wrote that opinion in 1905, they upheld it in 1922 as a result of the 1917, 18, 19 H1N1 outbreak. And you'll notice I didn't say it is the Spanish flu. The reason I don't call it the Spanish flu is that's probably the ultimate misnomer in all of public health. But it started in 1917, ended in 1919. So we just call it the 1917-18-19 flu epidemic. It was an H1N1 outbreak. There was a very similar one in 2009. Partial truth. Vaccinated people still get COVID. Yes, they do. The point of vaccines is really to give the immune system a head start. And by doing that, we can lessen the severity of the symptoms. We can lower the ability for that virus to be passed on from one individual to another. We really don't have some good data on how well the vaccines do that. We do have great information on how well it prevents serious problems in vaccinated individuals. And if you want more information about that, see Mississippi. The Viron is too small for cloth masks. I hear this one a lot too, and it's not that the virus can't get through a mask. It can. Okay, so let's lay that one to bed right now. Yes, technically you are correct by saying that the virus particle itself, otherwise known as the Viron in technical terms, is too small for a cloth mask. I'll lay that right out there. I'll be fully transparent. They're right. However, that Viron is trapped inside all of your saliva particles and your basically the moisture that you expel as part of breathing. And what we're trying to do with the mask is we're making the mask wet, because if we make the mask wet, it's trapping that virus particle and the water that's surrounding it into the mask. So yes, the Viron itself is too small for masks. However, really what we're trying to do is prevent the droplet. And while we're on that subject, an N95 mask is the ultimate in preventing or trapping those virus particles. However, they are very disposable. They are also very expensive, and in times of a medical crisis, they can land in short supply. So we would prefer to use those only on medical professionals. And the whole concept of the cloth mask thing was back in the early days of the pandemic, Dr. Fauci at the National Institutes of Health said that cloth masks are likely not going to stop the virus from spreading. That's where this particular partial truth comes from. It was the early days of the pandemic. We learned a lot more since then. So that information has since been updated. My body, my choice. Yeah, technically you have my body, my choice in the United States. However, if you choose not to get vaccinated, my body, my choice is going to become the virus or the government mandating that you get a vaccine. And we really don't want to go there as a country. Kind of tramples on a whole bunch of individual liberties, sets forth a very slippery slope. So if you are able and you are comfortable, please get vaccinated. The vaccine is not fully researched. This particular partial truth comes out of the fact that the vaccine was developed, or the vaccine that covers COVID-19 was developed, manufactured, studied, and released within less than 7 or 8 months worth of production and study. So, yeah, I get where you can make that statement and be factually accurate. However, the technology behind the vaccine has been studied for well more than 10 years. And in fact, we do have some vaccines that are already in place that use this mRNA technology that we're using here. And yeah, we know kind of what the dosing structures look like, and the fact that there are similar looking vaccines out there. And so the technology itself has been in place, and in fact, one of the other mRNA vaccines that's in development right now is about to enter phase 3 clinical trials, and that one is to prevent HIV infection. We're finally getting to the point now where we are comfortable saying that we have an HIV vaccine that's ready to go. Uses the same technology as COVID-19. The vaccine uses cells from an aborted fetus. I saw this one last night on a news website, particularly pertaining to the Western Michigan case I talked about earlier in this video. And the process itself requires what's called cell culturing, in which case we need to develop mRNA to put into our vaccine. We need a cell to replicate that so we can put enough instructions out there for the spike cells to be really accepted by the body, the vaccine to really be uptaked. Those are currently using stem cells from fetuses to really do that. Are you actually getting the cells themselves from aborted fetuses? No, you are not, but that's part of the manufacturing process. So yes, on the partial truce. The Vatican did come out back when the vaccines were first being released for general population use and said it is okay in Catholicism. You're not really supporting the concept of abortion, so it's okay. So as far as the religious argument from the Catholic Church standpoint, that doesn't really hold water. As far as truth goes, more vaccines save lives. Yes, we saw that in the UK statistics where they have pretty much got herd immunity already, and it is saving lives there. They've had less than 1,000 deaths a day for quite some time in the UK. Masks prevent infections. That truth is also developed and it's obtained from the influenza statistics that we had from this year's flu season. And this year's flu season, we essentially didn't have one. Where we would typically have at least 1 million infections of influenza that are diagnosed in a year, we had less than 60,000 in the entire United States. The flu season was so absent this year that the World Health Organization, who develops the criteria for each year's flu vaccine, had real difficulty understanding which strains of flu were actually being circulated because we really weren't circulating them. So this information about masks preventing infections, that predominantly comes from flu, and we know that from COVID-19 as well that it does slow the spread. And ultimately, the penultimate goal is to keep our health system from being overrun. And right now we're losing that battle in certain states and we're winning that battle in others. So we'll take that as it is. But right now, mask use is well evidenced. The vaccine is now well evidenced, given the fact that we've had hundreds of millions of those vaccines administered in the last 6 to 12 months. And in places where the vaccine rates are higher, we are seeing fewer and fewer hospitalizations. We are also seeing fewer and fewer deaths as a result of COVID-19. So a lot of these public health measures are now rooted in evidentiary science, and all of this misinformation is background noise. And hopefully people can walk away with having some background knowledge. So I wanted to leave you with a couple of things that I see as what is going to really end this pandemic. And these are evidence-based things that I've seen. Number one, consistent messaging from everybody. Let's get all on the same page, ignore the noise. So as long as our governments can start getting on the same page and start giving a consistent message, we can get out of this a little bit faster, because then we start building some public confidence. As long as we're not getting into this, okay, one government agency wants us to do one thing and another government agency wants us to do another thing. The haphazard response in the United States has been a lack of consistent messaging. Governments that have had consistent messaging, Australia, New Zealand, United Kingdom, have fared a lot better than the United States have. The United Kingdom had a rocky start. I think a lot of that was just the learning curve of the virus itself. Be that as it may, the countries themselves have unified against the common enemy of the virus and not each other. Pandemics last a lot longer if people start distrusting each other. Wearing masks if you're indoors for more than 15 minutes. Obviously your home probably would be an exception here because you're not really in contact with a lot of people. But if you're going to be indoors in a space where you're close to other people for 15 minutes or more, like the grocery store, the home improvement store, granted, I can get lost in a Menards pretty darn easily. If you're going to be in a place where there are a bunch of other people, basically, and you're going to be there longer than 15 minutes, strongly advise that you would wear a mask. Public transit obviously would be in this mix as well, especially if you're in the sardines public transit zones of like New York. Here in Grand Rapids, the number of people that ride a rapid bus is not as high, but masks are still probably a good idea while you're in public transit. Stay virtual as much as possible, and this is going to go along with number 6. But as long as you're able to get away from other people and do things remotely, especially if you're going to be intermingling households, it's probably a great idea just to stay virtual for the time being until we really get some good control on some of this mess. If you are able, getting vaccinated is predominantly important, and one of the things that should have stood out to you in this video as we've gone along is Great Britain is faring a lot better than some U.S. states. And we're talking about one country versus one U.S. state. That's kind of scary. Wash your hands, and if you can't, use hand sanitizer. The alcohol should be more than 60%. If you are sick, stay home. This is probably the one place in the United States culture of work really has not improved much. I still see people coming into work and they're not exactly healthy. I stay out of their office suite as much as humanly possible. So if you are sick, please stay home if you're able to. It's vitally important to your community. And I think one of the things that I didn't put on here, and one of the things that's most valuably important in all of this, is remember that this is not an exercise in keeping one single person healthy. It is keeping an entire community healthy. When the framers of the Constitution developed our Constitution, they gave us 3 rights in the 4th Amendment that the government cannot take away from us. The first one listed is life, the second one listed is liberty, and the third one listed as property. They are intentionally listed in order, which means everybody has a right to life above personal liberties. So keep that in mind. Stay healthy, stay safe. We love you.